Alright, so I have this trickish exam question here. So they were saying that why would an asthmatic patient taking the beta 2 receptor agonist drug mainly develop asthmatic attack again? Right. So the full question is that why would a stable um, asthmatic patient who is on beta receptor agonist suddenly develop asthmatic attack again? Now, if you have gone through the introduction to pharmacology classes, you get to know that there is a phenomenon known as tolerance of drug. All right. So sometimes when you take a particular drug for a very long time, your body get used to it. In Nigeria, we call that thing C finish. C finish is like somebody of a lower class. You are trying to show the person love, but the person is now trying to disrespect you. Before, when the person was not like when the person was not getting to talk to you, the respect was so there. But as you got to talk to them, they're trying to like saying right now they know you, so there's no respect. Same way asthma can do to beta 2 receptor agonist drugs. Okay. So I have a simple response to this question here, and I have a detailed one. So for the simple one, we say that this is as a result of tolerance to B2 receptor agonist or insensitivity to the agonist drug. Right? So in such a patient, right, an alternative drugs which can be used is anticholinergics. Right? Anticholinergic drugs can be used. Right? So these are the different examples of beta 2 agonists: albuterol, formoterol, salmeterol, and all of that. Okay. So some people call albuterol albutamol. Some people call salmeterol salbutamol and all of that. So we have a comprehensive response to that question. We say that asthmatic patients taking beta 2 receptor drugs, that's the beta 2 adrenergic agonist drugs, they can sometimes experience what? Asthmatic attacks again. And this is due to a phenomenon called what? Tachyphylaxis or beta agonist induced what? Bronchospasm. Alright? So sometimes it's due to tolerance. Okay, here are some few reasons. Tolerance. So over time the body can become less responsive to beta 2 receptor drugs, requiring higher doses to achieve the same effect, right? So this can now lead to what? Reduced therapeutic benefits and increased risk of asthmatic attacks. Rebound effect. The prolonged use of this beta 2 agonists can cause a rebound effect where the airways become more sensitive and prone to bronchospasm when the medication wears off. Alright, inflammatory changes. Chronic inflammations in the airways can now lead to what? Changes in the beta 2 receptors themselves, making them less effective. Now, this can now result into what? Reduced bronchodilation and increased risk of what? Asthma exacerbation. Then sometimes it's overuse. Overreliance, alright, on the drug for quick relief can now mask the underlying inflammation that needs to be managed, okay, or with other drugs. Do you understand? So to mask it for a very long time that it cannot mask it again, so it will now show off. So these are the possible reasons.